Hey everyone, and welcome back to the channel. Today, we're diving deep into a topic that affects millions of people worldwide: cholesterol management. Specifically, we're going to talk about one of the most commonly prescribed medications for it, Atorvastatin. You might know it by its brand name, Lipitor. So, what exactly is it? How does it work? Ned, what are the pros and cons you should be aware of? Let's get into it. First off, what is atorvastatin? It belongs to a class of drugs called statins. The primary job of statins is to lower the levels of bad cholesterol, also known as LDL cholesterol, in your blood. Our livers naturally produce cholesterol, which is essential for building healthy cells. But when we have too much LDL cholesterol, it can build up in our arteries, forming plaque. This process, called atherosclerosis, can narrow the arteries and increase the risk of serious health problems, like heart attacks and strokes. So, how does atorvastatin jump in to help? It works in two main ways. First, it blocks an enzyme in your liver called HMG-CoA. This enzyme is a key player in the cholesterol production line. By blocking it, atorvastatin effectively slows down your body's cholesterol factory. It helps your liver become more efficient at removing the LDL cholesterol that is already circulating in your bloodstream. Chet. The combined effect is a significant drop in your overall LDL levels. Doctors often prescribe it not just to lower cholesterol, but as a preventative measure for individuals at high risk of cardiovascular disease, even if their cholesterol isn't sky high. Now, let's talk about the pros, because they are quite significant. The biggest advantage of atorvastatin is its proven effectiveness. Numerous, large-scale studies have shown that it can dramatically reduce the risk of heart attacks, strokes, and even death in people with or at high risk for heart disease. It can lower LDL cholesterol by up to 50% or more, which is a game-changer for many patients. It also has a modest effect on raising HDL, the good cholesterol, and lowering triglycerides, another type of fat in your blood. For most people, it's a once-a-day pill that's easy to incorporate into their routine. Of course, like any medication, atorvastatin isn't without its potential downsides and side effects. It's important to discuss these with your doctor. The most commonly reported side effects are muscle aches and pains. For most people, this is mild, but in rare cases, it can be a sign of a more serious condition called rhabdomyolysis, which involves muscle breakdown. That's why it's crucial to tell your doctor immediately if you experience severe unexplained muscle pain, tenderness, or weakness. Other potential side effects can include digestive issues, like nausea or diarrhea, headaches, and in some instances, it might slightly increase blood sugar levels, which is something for people with or at risk for type 2 diabetes to monitor with their doctor. It can also affect liver enzymes. So, your doctor will likely perform blood tests to check your liver function before and during treatment. They will look at your total cholesterol, LDL, HDL, and triglyceride levels, and it works best when combined with a heart-healthy lifestyle. That means a balanced diet, low in saturated fats, regular physical activity, and not smoking. These lifestyle changes are the foundation of managing cholesterol. To wrap it all up, atorvastatin is a powerful and effective tool in the fight against high cholesterol and cardiovascular disease. Its ability to lower the risk of heart attacks and strokes is a massive pro that has helped millions live longer, healthier lives. It's essential to be aware of the potential side effects, particularly muscle pain, and to maintain open communication with your doctor. 2. If you found this video helpful, please give it a thumbs up, and don't forget to subscribe for more health content.